Did you know that 81% of 10-year-olds are afraid of being fat? Did you know that in the United States, up to 24 million people of all ages and genders suffer from an eating disorder, which has the highest mortality rate of any mental illness? In our society today, the media is continually pushing for this Photoshop picture-perfect body image. Becoming further educated on certain disorders could help prevent you or a loved one from a hospital visit or possible death. In the beginning of my freshman year of high school, one of my best friends was diagnosed with anorexia. I couldn't believe it until I saw her lying in the hospital bed with a feeding tube. She was already naturally thin, meaning 90 pounds, so you can only imagine how thin she was. It was really hard seeing her go through something like this, especially with us being so close. Today I would like to talk with you about some of the different types of eating disorders: anorexia, bulimia, and obesity. First, let's start off with anorexia nervosa. Anorexia is a disorder characterized by an obsessive desire to lose weight by refusing to eat. According to the National Association of Anorexia Nervosa, it states, a person with anorexia may have an intense fear of gaining weight or becoming fat. Someone with anorexia may practice unhealthy behaviors, such as restricting calories, only eating specific foods, or skipping meals frequently. At this point in time, there is no sole cause to this disorder, but research is continual. With this, it can be inferred that any disorder involving someone's emotions will allow room for interpretation. Anorexia is more common in women than in men. Anorexia is hard to diagnose for anyone because of denial and how they want to be secretive about their disorder. Many individuals who are affected with this disorder will not seek professional help. Anorexia symptoms and risk factors include maintaining body weight, fear of gaining weight, self-perception is distorted, and missed menstrual cycles. The main goal in treatment for anorexia is for the patient with the disorder to just gain weight. Anorexia can be treated through outpatient care or hospitalization. Without the treatment, the disorder could be fatal. The next eating disorder I would like to discuss is bulimia nervosa. According to Diane Papalia, author of Experience Human Development, bulimia nervosa is characterized by recurrent and frequent episodes of eating unusually large amounts of food and feeling a lack of control over the eating. This binge eating is followed by a type of behavior that compensates from the binge, such as purging, use of laxatives, fasting, or excessive exercise. The same as anorexia, bulimia has no definite cause. According to Dr. Thomas Insel, director of the National Institute of Mental Health, he states, these eating disorders are fundamental brain disorders. There does seem to be a genetic factor. The genetics don't cause the disease. They set you up for risk. It seems to begin with the unhappiness of their self-image, causing them to become depressed, which in turn will cause them to eat more, then resulting in them vomiting. Bulimia can be diagnosed by repeated binge eating and purging. Although it doesn't have the serious side effects as anorexia, it does still have consequences for the binging and purging. By making yourself throw up, it can make your teeth decay and cause sensitivity to your food. The treatment for bulimia includes medicines like antidepressants, which have been known to help with this disorder. Also, patients can be hospitalized to help monitor the patient and get their habits stabilized. The final eating disorder I would like to discuss with you is obesity. Obesity can be defined as an excessive amount of body fat, and it has become very common in the United States in the past decade. The problem with obesity is it is followed by many health risks. There are thousands of deaths per year that are directed towards obesity, but not only can it cause death, it can increase some of the following risks: type 2 diabetes, high blood pressure, cancer, stroke, and many more. Obesity can be caused by a number of things. A person's genetics comes into play if both of your parents are obese. There is also overeating, which can lead to weight gain and a slow metabolism. No physical activity can also contribute to obesity. In order for obesity treatment to become more effective, we will have to become more educated. Exercise is key to dieting. It can help in achieving goals with weight loss. Medication can also be administered if the person with the disorder has a health risk. As a final point, I hope the information you have received today will give you a better understanding of signs and complexities of eating disorders. Eating disorders can develop from a variety of reasons that are unique to the individual. Just as life is an individual thing, so are an individual's explanations, attitudes, thoughts, ideas, and ultimately an individual's actions. While life is full of unanswered questions, as well as it is full of unexplained circumstances due to the originality in human behavior. Remember, an eating disorder is not just about the food.